So I've been doing this for about 20 years. I've had lots of injuries. I played professional hockey, so concussions, things of that nature, broken bones. And I've been doing this for about 15 years as a professional. So I've estimated I've helped about 100,000 people with their health questions. My job is not to always talk about the bad stuff, but about the good stuff. What can you do? How can you become educated? I think the general practice of healthcare is obsolete these days. Each person's an individual. So maybe the type of diet you should be following is different than what you should be following. How much water should we be drinking? What kind of exercise we should be doing? Everything's an individualized plan because none of us have enough time. We're super busy. We're going from class to class and we're crazy kids all the time, right? We want to be effective and efficient. So if we want to improve our weight, we want to increase our weight, we want to decrease our weight, how do we make it effective and efficient? What about supplements? What about minerals? What about types of foods we should be eating? The average American diet, too much starches. Okay, we should be having 40% carbohydrates, 30% protein, 30% fat. Fat does not make us fat. Okay? Not even saturated fat. They just did a 10-year study on saturated fat, so heavy fats with meats. Okay? No correlation between having high saturated fats and heart disease. Okay? It's a lie. So why is it that our kids are getting heavier and heavier? I'm 40 years old now. I don't remember when I grew up, a lot of heavy kids. Now when I work with kids, their parents are like, I don't know why they're getting heavier, doc. Let's take a look at their diet. Okay? I have them write down what they're eating. I put it into a system that we have. It breaks it down. Starches, fats, carbohydrates, proteins. Are you hydrated? Are you having enough vitamin D? Okay? Go outside for lunch. I know it's hard for us to get outside when we live in Southern California. It's sunny all year round. You want to increase your vitamin D content, especially for females? Go outside for 10 minutes every day. So what we do for patients is we examine to see how your digestive system is actually working neurologically. We also take a look at whether or not you're hydrated, so water in your cells, versus inflamed. Because if you have too much inflammation, you can't be healthy. If you're too acidic, okay, bacteria lives in acidity, cancer grows in acidity, we have to become alkaline. What kind of food should we be taking? Things break down. So prevention compared to waiting for it to happen is a better option. It's also a cost-effective option. 60,000 thoughts a day, okay? 85% of them approximately are negative thoughts. Now, the reason I think this is happening is because we're not healthy. So when you're kind of in a sickness mode or stressed all the time, it's hard to be happy all the time. But the system that controls your immune system, controls your stress, is your nervous system. Genetically speaking, we can actually break down and see how your body breaks down fats. So we can determine whether or not you should be doing high-intensity interval training, a high rate of your heart rate, or sustained exercise. More effective, more efficient. So now you know exactly how you should be exercising to accomplish what goals. Also through genetic testings, we can figure out what percentage of carbs, proteins, and fats you should be intaking that's ideal for you.
Said number one indicator of aging is loss of muscle. But does that apply to those who do not eat meat, right stuff? So I don't know.
Well, it's harder to get quality proteins if you're having other types of meat proteins like fishes or pork.
I do eat fish. No,
yeah, that's great. Yeah.
But it's still loss of muscle, right?
Yeah, after the age of 30, we're losing about half a pound of muscle mass. Doesn't matter what our diet is, unless we're stressing our muscles and utilizing our muscles. You know, the average person doesn't really exercise, so you got to exercise.
I do too.
Yeah, so good.
So non-fat, you recommend? I'm getting non-fat yogurt. I love plain yogurt. Switch to low-fat yogurt.
Switch to fat yogurt.
Fat yogurt.
Yeah, switch to regular yogurt. Trust me. Here's what you do. Write down what you eat for 2 days. Okay? Bring it to me. We'll break down exactly how much carbs, fats, and proteins you have. Yeah. And then we'll tell you whether or not you're getting enough fat.
I have a breakfast question. Is it the earlier the better?
Just eat breakfast.
Because I usually drink a shake as my breakfast, but it goes from like morning down to like end of recess and beyond. Am I waiting too long? I just do it slowly.
What's the time frame?
I don't know, like between 8 and 10:30.
So drink your shake as fast as you can or as quickly as you can to get the consumption of 200 calories. And then your second snack might be a couple almonds. No information that's up to date to how we're living our lives. That's why there's 50 different locations throughout the states, and I work with different doctors that develop programs that are what society needs today, what we need today to understand how healthy we are. Because guess what? Once again, we're getting overweight. We're becoming metabolic problems. We're becoming diabetic. Let's prevent those problems. We can make a change today.